Hello everyone, welcome back to the Austin Physio YouTube channel. Today's video we're looking at why am I getting pain down the side of my body. So what are some of the most common musculoskeletal conditions that can trigger pain into the side of the body, around that hip and around that lower back area? So number one is myalgia or muscle pain into the Quadratus Lumborum muscle. So the Quadratus Lumborum muscle is vital for that core sit of support. So that core support working as an antagonist muscle to the abdominal muscles around the front. It is a key postural supportive muscle working alongside the multifidus and those deeper rectus spinae muscles, and it also braces the 12th rib on and during inspiration. So what are the attachments of this muscle? So the reason why I talk about the attachments is it's really important in terms of pain referral. So although it's attached around the back of the body, it's very common when it's tender that it goes around into the flank and into the side of the body, so might be responsible for pain in this area. It attaches from the upper part of the iliac crest, blending with that thoracolumbar fascia, blending with the transverse processes of L1 to 4, and then attaching up into the 12th rib. So what might someone present with in clinic? So what's very common is they've either done something repetitively where they've been lifting or twisting through the body that's caused fatigue and soreness into the back of that area. It might be that they've had a cough or a cold where they've got tenderness around the ribs that have also triggered into that QL muscle. It could even be repetitive postural positions. So if they're sitting a lot with work and maybe they haven't got that good core support, it puts more pressure around the back of the body, which has caused this to fatigue over time. So we want to talk through this in terms of the case history. One of the key things that we would see is actually on palpation of that particular muscle and around that area. We would look to see where the tender points are. We would look to see the rib mechanics, how it's breathing, how it's moving when someone side bends away, in order to pinpoint where that pain's coming from. What we would then look at in terms of treatment and management is softening and releasing through that area, helping to improve rib mechanics so that we're not contracting or compressing through that area. So if we're only doing upper rib breathing and we're not using the diaphragm, that might be impacting how that muscle's being used. And finally, we want to remove any triggers or activities that has caused that area to become sore and fatigued. The second cause of pain or tenderness down the flank and the side of the body might be myalgia or muscle pain or injury into the big latissimus dorsite muscle. This large, broad muscle attaches from the lower 6 to 12 thoracic vertebrae, spinous processes, the lower 3 or 4 ribs, blending down with the SPs from that point all the way down to the lower sacral area, blending with the thoracolumbar fascia, then attaching up into the bicipital groove of the humerus, so right the way up the side of the body. It has a key function as an accessory muscle of respiration, so helping us with breathing, and a primary function in the upper extremity of adduction of the arm, so bringing the arm into the side. It is vital for many activities that we do day to day, where it stabilizes through the trunk as well as allowing movement through that shoulder. Anything where we're lifting or pulling down or twisting through the body is going to be firing through that muscle. So what someone typically presents with if they're struggling with injury in that side is they're going to have pain down the side of the body. So where you're struggling with pain down the side of the body, there might be specific activities or trauma that can trigger pain into the lats. So you can either have direct trauma into the side of the body if we've fallen. It could be that we've pulled or strained through the hip that might be causing pain to come up. More commonly, because of the blending with the thoracic vertebra and the ribs, any repetitive coughing or sneezing or aggravation through the thoracic cage can cause soreness and tenderness into that latissimus dorsi muscle. So what would we talk about? How would it be managed in clinic? So one of the first things, like we spoke about already, is going through the case history, working out A, how this muscle became very sore and injured, and B, if any other structures are involved. Even when we were talking about the QL earlier, it's very much a grey area. There's a big overlap between different areas, so it might be that different muscles are involved. What we would also look at during the consultation is really palpating and pushing around the attachments up into the shoulder, looking at that spinal movement to see how that's feeling, particularly looking at rib movement to see how they're breathing. If it's really compressed or sore, it might be altered, as well as shoulder function and movement to see if that might be aggravating or adding to the soreness around this area. What we would look at in terms of treatment is softening up through the area, getting someone to stretch through the latissimus dorsi muscle, and most importantly, looking at mechanics through different areas and stopping this from coming back again. So the third condition that we're going to talk about today is a strain or aggravation of the intercostal muscles. Your intercostal muscles are absolutely vital to help with rib mechanics and breathing, with your internal, external and innermost intercostal muscles blending together to allow the ribs to expand and contract when we're breathing. So if someone's had a horrible cough or cold, or even if they've had trauma into the side of the body or they've twisted, this can cause pain to be aggravated into those intercostal muscles, not only giving typically one-sided or unilateral tenderness in those muscles located between the ribs, but also referral typically down the side of the body, because even if it's the intercostals that have been aggravated first, the body always tries to adapt, so other areas might become tight to help with that breathing. Or if it's from trauma, it might be the QL, latissimus dorsi that we spoke about earlier, might be involved with that injury. So it becomes a very muddied picture in terms of where the pain is, but typically for an isolated intercostal muscle strain, very specific, very pinpoint. Worse for breathing and moving, typically away from the side of pain. And we typically know the onset as it's very specific in terms of aggravating those ribs. Finally, it's really important to talk about different systems that can refer into this area. So we need to be aware that it might not be mechanical in terms of pain through this area. So it could be referring potentially from the liver, from the kidneys, sometimes from the digestive system into the side of the body. But what normally accompanies these different conditions that are referring that aren't mechanical are systemic features or systemic symptoms. So what we would always recommend if you're getting changes in certain symptoms flagging up is speaking to your GP first, having that assessed properly, and then when that's been ruled out, then speaking to a musculoskeletal expert.